I am Dr. Sarita, Professor of Anatomy. I'll be discussing medullary syndromes. Medullary syndromes are two types. Medial medullary syndrome is caused by the lesion of medial part of the medulla oblongata, and it is due to the infarction of vertebral arteries or anterior spinal arteries. Lateral medullary syndrome is caused by ischemia in the lateral part of medulla oblongata as a result of blockage of vertebral arteries or posterior inferior cerebellar artery. Medial medullary syndrome or Dejerine syndrome or anterior spinal artery syndrome. The important features are the paralysis of the hypoglossal nerve nucleus and the nerve fibers, and it can lead to ipsilateral flaccid paralysis of the tongue muscles. The second important feature is the involvement of medial lemniscus. It can cause contralateral loss of fine touch, vibration, proprioceptive sensations from the trunk including the extremities. The third important feature which is involved is the pyramids. It can involve the contralateral plastic hemiparesis or hemiplegia. The lateral medullary syndrome or Weinberger syndrome or posterior inferior cerebellar artery syndrome. Their important features are six important features. First is the vestibular nuclei. Involvement of vestibular nuclei can lead to nystagmus, nausea, vomiting and vertigo. The second is the involvement of inferior cerebellar peduncle. It can cause ataxia, dysmetria and dysdiadochokinesis. The third important involvement is the nucleus ambiguous, which is located in the reticular formation, and the involvement of this nucleus is the cranial nerves 9, 10 and 11. It can cause dysphagia, loss of gag reflex and dysphonia, that is hoarseness of the voice. The fourth important feature is involvement of the spinal lemniscus or spinothalamic tract. Involvement of this tract can involve the contralateral loss of pain and temperature from trunk including the extremities. The fifth important feature is involvement of spinal trigeminal nucleus and its tract. It can cause ipsilateral loss of pain and temperature from the face. The last and the most important feature is the descending sympathetic tract, and it can involve the ipsilateral Horner's syndrome. The causative role of medial medullary syndrome and lateral medullary syndrome during autopsy or imaging studies illustrate that hypertensive medullary hemorrhage does exist. It can be also due to the involvement of cavernous angiomas, which are relatively frequent and can cause medullary hemorrhage. Treatment involves it initiates the intravenous recombinant tissue plasmogen activator for thrombolysis within 3 to 4.5 hours of the ischemic stroke symptom onset. The benefit of this theory is dependent on time, so it should be started as soon as possible. Thank you very much.